It sounds almost too simple to be real. Sit in front of a glowing red panel for a few minutes a day, and your skin starts to look smoother, clearer, even younger. No needles, no harsh chemicals, just light. That promise is exactly why red light therapy has exploded in popularity. Celebrities swear by it, skincare brands are building entire product lines around it, and at-home devices are selling faster than ever. But here's where things start to get uncomfortable. Because when you look past the perfect lighting, the before and after photos, and the glowing reviews, a different picture begins to appear. Some dermatologists say it can help. Others say the benefits are limited. And a few quietly point out that most people are expecting far more than this technology can actually deliver. So what is real and what is just hype? To answer that, you have to understand what red light therapy is actually doing beneath the surface of your skin. Red light therapy uses specific wavelengths of light, typically in the red and near infrared range, that are able to penetrate the skin without causing damage. Unlike ultraviolet light, which breaks down skin cells, this type of light interacts with your cells in a much more subtle way. It reaches the mitochondria, the part of your cells responsible for producing energy. When these mitochondria absorb the light, they become more efficient at generating that energy. And this is where everything connects. More cellular energy means your skin cells can repair themselves more effectively. It means faster recovery from minor damage, better turnover of old cells, and potentially an increase in collagen production. Collagen is what keeps your skin firm and smooth. As you age, collagen levels naturally decline, which is why fine lines and wrinkles begin to appear. So in theory, anything that helps support collagen production should improve how your skin looks over time. And to be fair, there is some real science behind this. Several studies have shown that consistent use of red light therapy can lead to measurable but modest improvements in skin quality. People reported smoother texture, reduced redness, and a slightly more even tone. But this is where most people misunderstand what those results actually mean. Because the key word here is not dramatic. It is subtle. This is not the kind of change where you wake up 1 week later and suddenly look 10 years younger. It is the kind of change that builds slowly, often so gradually that you might not even notice it day to day. And that difference between expectation and reality is exactly where the confusion begins. Another important factor that rarely gets talked about is the strength of the device itself. Not all red light therapy is equal. Professional devices used in clinics are significantly more powerful than most at-home versions. They deliver higher intensity light at more precise wavelengths, which means they are more likely to produce noticeable effects. At-home devices, on the other hand, are designed to be safe and convenient, but that also means they are often weaker. So when someone buys a small handheld device expecting the same results they saw in a clinical setting, the outcome almost never matches the expectation. And this creates a cycle where people start to question whether the technology works at all. But the reality is more nuanced. It is not that red light therapy does not work. It is that the version most people are using may not be strong enough to deliver the results they were promised. There is also the issue of how broadly this technology is marketed. If you look at advertisements, red light therapy is often presented as a solution for everything at once. Wrinkles, acne, inflammation, scarring, even overall skin rejuvenation. But these are completely different biological processes, and they do not all respond the same way. For example, when it comes to acne, red light therapy may help reduce inflammation, which can calm irritated skin. But it does not directly target the bacteria that cause acne in the same way that blue light does. So if someone is expecting it to completely clear their skin, they may end up disappointed. When it comes to anti-aging, the case is a bit stronger but still limited. Yes, there is evidence that red light can stimulate collagen production, but the increase is relatively small. This means improvements tend to be mild rather than dramatic. You might notice your skin looks slightly smoother, or that fine lines appear softer over time. But it is not going to replace more intensive treatments like retinoids, chemical peels, or professional procedures. And this leads to one of the most important insights in this entire conversation. Red light therapy works best when it is seen as a supportive tool, not a standalone solution. Once you understand that, everything else becomes clearer. Another detail that plays a huge role in results is consistency. Most of the studies showing benefits involve regular use multiple times per week, often over several weeks or even months. Using it occasionally or stopping after a short period is unlikely to produce noticeable changes. And even with perfect consistency, results still vary. Skin type, age, lifestyle habits, and overall skincare routine all influence how effective it will be. Someone who already has a strong routine may notice small improvements, while someone expecting a complete transformation may feel like nothing is happening. There is also a psychological factor that cannot be ignored. Social media has created an environment where results appear instant and dramatic. Perfect lighting, filters, and carefully selected images can make subtle improvements look far more impressive than they really are. So when people try red light therapy in real life, the results can feel underwhelming, even if the technology is doing exactly what it is supposed to do. This does not mean the benefits are not real. It just means they are often overstated. And that distinction matters more than most people realize, because when something is oversold, even real benefits can feel like disappointment. There's also the question of safety. In general, red light therapy is considered safe when used correctly. It does not involve UV radiation, so it does not carry the same risks as sun exposure or tanning beds. However, that does not mean it should be used carelessly. Using devices too close to the eyes without protection can be risky, and ignoring recommended usage guidelines can reduce effectiveness or potentially cause irritation. Another important point is that more is not always better. Longer sessions or more frequent use does not automatically lead to faster results. In fact, cells respond best to specific doses of light, and exceeding those doses may not provide additional benefits. So again, understanding how to use it properly is just as important as using it at all. At this point, the picture becomes much clearer. Red light therapy is not a scam, but it is also not a miracle. It sits somewhere in between. There is real science supporting its effects. There are real benefits that people can experience. But there are also limitations that are often ignored in marketing and online discussions. And that is exactly why so many people feel confused about it. Because both sides are partially right. The technology works, but not in the way many people expect. So if you're thinking about trying it, the most important thing you can do is adjust your expectations. Do not expect instant transformation. Do not expect dramatic before and after changes. And do not expect it to replace every other part of your skincare routine. Instead, see it for what it actually is. A tool that can support your skin over time. A small advantage, not a complete solution. A long-term investment, not a quick fix. And when you approach it that way, the results start to make a lot more sense. If you want more videos that break down popular health trends without the hype and show you what actually matters, make sure to subscribe to the channel. Because the next big trend everyone is talking about might not be what it seems either.